the mental health issues here haven't been talked about much. We don't really have much of a mental health safety net in this country. There's almost nobody watching today.
It's something we never talked about. Like for instance, the kid in Virginia Tech,
or the two police officers that were killed at the Capitol 10 years ago.
Right.
The young man that killed them was off his medication. He had sort of fallen out of the grip and the embrace, if you will, of the mental health system. I'm thinking he was from Montana, I believe, if I remember right, and he had lost his kind of community support because of budget cuts. I mean, we've got to talk about. There's almost nobody watching today that doesn't have somebody in their family with some mental health issues. It's very common of various degrees, and this young man should have been identified at the community college when he was thrown out of that community college. Is something that doesn't happen very often. For at least the authorities to visit him and offer him counseling. The mental health safety net's pretty shredded in Arizona, as it is nationally.
Well, talk about that. Talk about, I mean, we witness it every day in the newspapers about what the budgets of various states have been drastically reduced, federal budget drastically cut, mental health programs. Places like Cleveland, Akron, New York, you name the city, you can walk around and see people living in the shadows right in front of you, untreated.
Yeah, and it's only going to get worse because state budget cuts. That's a pretty easy place for people to go after. Let's cut some of the mental health outreach. It might mean some more homelessness, but most people that dress like this in politics don't see them, don't talk to them, don't know them. Even though maybe when we pass mental health parity, with the health care bill, that should help. But most of this is state level mental health programs, and we've really got to guard against shredding them even more than they've been shredded.
Okay, so if you could rework budgets, you'd really put money behind mental health?
Yeah,
over what though? Right? Because then you got the cuts on the other end.
Well, I'd say over the war in Afghanistan, we should withdraw troops sooner. I mean, if you want to go into that kind of sort of macro discussion, but I mean, mental health services and mental health issues are just as important as physical health.
But it's much more complicated. I mean,
of course it's
looking at now a staggering number of children who are diagnosed with bipolar disorder, who are on medication. We're talking about millions of kids. We're talking about kids who get labeled with ADD, ADHD, bipolar disorder, ODD, oppositional defiance disorder, which means they can't behave, and therefore they get special help. I mean, it's so controversial, and there's so many different ways you could go with this. It's almost
but the problem,
where would you put the money?
The problem for so long is in this country, there's been such a stigma attached to mental health disorders, whether even depression. That so many Americans are inflicted by. You don't talk about it. You don't treat it. Tragedies happen.
And we in no way should any of this discussion be to demonize people with mental illness, because so many afflict so many people, in some mild forms, some severe forms. Few of them will ever reach a position where reach a stage where this kind of violence is committed. But the mental health system as a whole, with what Mika just said, with all the different disorders, especially for children now, and it happens in the schools. They don't know what to do because they don't have the school nurses. They don't have either. They can't afford the medication, or they don't have the counselors, or they can't send them out of the schools into a mental health safety net.
Convoluted mess.